I'd like to introduce our guest today, Dr. Heather Ray Paschal. Thank you for joining us today, Heather.
Hi, thank you for having me.
So can you tell us, what does it mean to you to be an LDN specialist?
So I really think that low-dose naltrexone is going to be something that changes a lot of people's life as more providers and more patients learn about low-dose naltrexone and the benefit that it can have. From a provider's perspective, using it in patients who've exhausted every other traditional avenue, or using it for patients who do not want to take the traditional path. And then for patients that are just looking for an alternative, potentially a safer alternative, one with less side effects, or they have exhausted every traditional avenue and yet they still are not satisfied with the outcome. To me, I want to be that gap as an LDN specialist that can answer those questions for new providers or providers that have had a little bit of an introduction, but still have questions that are still uncomfortable with dosing, that still need another provider giving them guidance and support or reassuring them that this is a good path for their patient. And I want to be a liaison for the patient that needs to provide or wants to provide education to their provider or looking for education for themselves. And I just talk to patients all the time that, as working in a compounding pharmacy, they're always asking, what can you do for me that's different than the retail pharmacist? And being an LDN specialist, I feel very confident that for a large portion of the population, I have a really good answer for them now. And I'm comfortable with knowing what patients to recommend it in, knowing how to titrate it, knowing how to dose it, and then knowing how to modify it if they have a side effect or symptom or something different than your typical patient. So I think for me, it's just having that knowledge and being comfortable talking to patients and providers and using it to kind of spread the word about LDN, because I think we need more people really out there just talking to patients and providers about it. I personally take it, so I know personally and professionally the benefit that it's done. So I'm excited about this kind of new direction that we're taking.